Welcome. Today we're delving into a heart condition often overlooked but potentially serious: tachycardia-induced cardiomyopathy, or TC. We'll explore what causes it, how it affects the heart, and what can be done to manage it. So, let's get started and unravel the complexities of this fascinating condition. Tachycardia-induced cardiomyopathy, as the name suggests, stems from prolonged periods of rapid heart rate. This rapid heart rate, known as tachycardia, isn't just a temporary flutter. It's a sustained elevation, often significantly above the normal resting heart rate. Common culprits include atrial fibrillation, atrial flutter, AV nodal reentrant tachycardia, and ventricular tachycardia. While occasional brief episodes of tachycardia are often harmless, chronic or frequently recurring episodes can significantly stress the heart, leading to TIK. Now, let's understand how tachycardia damages the heart. Normally, the heart contracts and relaxes efficiently, filling with blood during relaxation and pumping it out with each contraction. When the heart beats too fast for extended periods, it doesn't have enough time to fill properly between beats. This reduces the amount of blood pumped out to the body, forcing the heart to work harder. Over time, this increased workload leads to changes in the heart muscle itself. The heart chambers, particularly the ventricles, can enlarge and become weakened, a process known as dilation. Furthermore, the heart muscle cells, or cardiomyocytes, can become dysfunctional and less efficient at contracting. This structural and functional remodeling eventually results in heart failure. Epidemiological studies suggest that tachycardia-induced cardiomyopathy is more common than previously thought, although the exact prevalence is still being determined. It often goes undiagnosed because the underlying tachycardia might be asymptomatic or only mildly symptomatic for a while. It affects both men and women and can occur at any age, but it's more frequently seen in individuals with pre-existing heart conditions or those prone to arrhythmias. The signs and symptoms of tachycardia-induced cardiomyopathy are often those of heart failure. Patients may experience shortness of breath, especially during exertion or when lying down. Fatigue is another common complaint, even with minimal activity. Swelling in the ankles, legs, and abdomen, known as edema, can also occur. Some individuals might experience palpitations or a racing heartbeat, while others might not be aware of the underlying tachycardia at all. Dizziness and lightheadedness are also possible symptoms, particularly during episodes of rapid heart rate. Diagnosing tachycardia-induced cardiomyopathy involves a multi-pronged approach. First, a thorough medical history and physical examination are crucial. An electrocardiogram, or ECG, is used to detect the presence and type of tachycardia. An echocardiogram, an ultrasound of the heart, assesses the size and function of the heart chambers, revealing any enlargement or weakening of the heart muscle. A Holter monitor, which records the heart's electrical activity over 24-48 hours, can identify intermittent episodes of tachycardia. In some cases, more invasive procedures, such as electrophysiological studies, may be necessary to pinpoint the source of the tachycardia. While there aren't distinct types of tachycardia-induced cardiomyopathy in the same way we classify other cardiomyopathies, it is typically defined by the type of arrhythmia that is responsible for the damage to the heart. These arrhythmias include atrial fibrillation, atrial flutter, supraventricular tachycardia, and ventricular tachycardia. The specific arrhythmia driving the condition influences the course of treatment and management. The primary goal of treatment is to control the underlying tachycardia and improve heart function. This typically involves a combination of medication and, in some cases, interventional procedures. Medications may include antiarrhythmics to regulate heart rhythm, as well as medications to manage heart failure symptoms, such as diuretics to reduce fluid overload, AC inhibitors or ARBs to protect the heart muscle, and beta blockers to slow the heart rate and improve heart function. Catheter ablation, a procedure to destroy the heart tissue causing the tachycardia, is often a highly effective treatment option. In severe cases, a pacemaker or implantable cardioverter, defibrillator, or ICD, may be necessary to regulate heart rhythm and prevent life-threatening arrhythmias. Preventing tachycardia-induced cardiomyopathy involves managing risk factors and promptly treating underlying arrhythmias. Regular check-ups with a healthcare provider are essential, especially for individuals with a history of heart problems or palpitations. Lifestyle modifications, such as maintaining a healthy weight, eating a balanced diet, limiting caffeine and alcohol intake, and avoiding smoking, can also reduce the risk. Early detection and treatment of arrhythmias are crucial to prevent the development of long-term heart damage. The prognosis of tachycardia-induced cardiomyopathy varies depending on the severity of the condition and the effectiveness of treatment. In many cases, controlling the underlying tachycardia and managing heart failure symptoms can lead to significant improvements in heart function and quality of life. However, In some individuals, the heart damage may be irreversible, requiring ongoing medical management and potentially heart transplantation. Recent research is focused on developing more effective antiarrhythmic drugs and improving catheter ablation techniques. Studies are also exploring the use of novel therapies, such as gene therapy and stem cell therapy, to repair damaged heart muscle. These advances hold promise for improving the long-term outcomes for patients with tachycardia-induced cardiomyopathy. Thank you for joining us today.